Dr. David Clark.
Well, Mr. Speaker, it is a delight to follow that member who has been praised by the Honourable Annette King as a good, as a sound member, in fact a sound lead of that select committee. And I think what we've observed there in the speech is that following Annette King is something many people should do. It is something wise people do everywhere. And actually, the member said that he followed the Honourable Annette King to Gore Hospital not long ago, and he might do well to advise the Honourable Jonathan Coleman also to follow the Honourable Annette King, because where the Honourable Annette King goes, there the health officials follow. I have to say that there have been many stories recently that have been broken in this House about what's going on in the health system. Certainly around the North Shore stuff we heard today, the staffing shortages there and the crisis and the challenges of meeting the medical need, the real struggle that's going on behind the scenes. The Minister clearly didn't know about it in the House today. He had no idea. The Honourable Annette King was informing the public, and I can bet you, not you, Mr. Speaker, I can bet the people at home, bottom dollar, that the health officials will be jumping as a result of Annette King's words today. And it was no different when she announced about a week ago the loss of orthopaedic accreditation in Dunedin at the hospital there. And it was not a couple of days either side of that where she announced the loss of accreditation of intensive care training in Auckland. The Honourable Annette King is the one who is driving the health portfolio right now. She doesn't collect the salary. I think she could be a bit disappointed about that. The Honourable Jonathan Coleman is still carrying the lunchbox around with the silver plate on it and collecting the salary, but he is not driving the officials, he is not driving the health portfolio. The visionary here is actually the Honourable Annette King, and this bill today is somewhat late in coming. The Honourable Annette King put a very similar but better one into the ballot 6 months ago. The Honourable Annette King, once again well ahead of the government, visionary, some would say. In fact, along those lines, if we observe that it was the Honourable Annette King that introduced the first nurse practitioner in 2002. 2002. And in fact, beyond that, in 2003, and I have a speech from the Honourable Annette King here which describes some of the things that nurse practitioners could be doing, which we are going to make happen today. This is from a speech in 2002. 13 years on, the government is catching up. It's no wonder everybody else in this parliament thinks it's about time this happened. 13 years ago, the Honourable Annette King was saying nurses provide consistently high-quality healthcare to New Zealanders, but there is considerable potential for them to contribute even more positively through responsive, innovative and collaborative health systems. That is leadership. Nurse practitioners will have an important responsibility in advocating health promotion and disease prevention. Part of their role will be to encourage self-care, but they will also have the skills to consider a wide range of health services that may suit individual patients. Vision for the primary healthcare strategy includes developing a high-quality workforce, a focus on better health for the whole population and a reduction in health inequalities. And of course we know under this government things have been going in the opposite direction. But we do congratulate them on finally, 13 years down the track, putting through some legislation that will enable these further steps that the visionary Honourable Annette King suggested way back in 2003. Now, it's cost effective, as the Honourable Annette King noted further on in that speech. It has more of a community focus, and the nurse practitioner concept is one that is now proven. It is one that we know brings cost-effective, efficient healthcare to New Zealanders. So this bill is a long time in coming, a very long time in coming. It makes a lie of the mantra of the government that says faster, sooner, more convenient, and I notice even Simon Connor was struggling to remember that mantra in his speech. It didn't roll off the tongue, and I don't think it would roll off the tongue of many New Zealanders. So the Honourable Annette King's bill, interestingly, if we note, does suggest a few extra things that could be achieved, and maybe they'll be put forward as amendments later in the process. Maybe they'll be discussed at select committee. For example, recognising the role of a nurse practitioner in legislation properly, amending the Adult Adoption Act 1985 that would enable a nurse practitioner to provide information on medical grounds, for example, allowing for the provision of genetic counselling, amending the Civil Aviation Act to enable a nurse practitioner to conduct medical examinations, amending the Education Act to enable a nurse practitioner to certify whether a child is well enough to go to school, and so on. Visionary stuff. 6 months ago, a bill was put in the ballot when Annette King's frustration at the lack of government progress became clear. She decided, well, let's try and do it ourselves. The government could have adopted it then, in fact, and we could have had it in law by now. But this is a government that has been dragging its heels. It seems a little distracted by other issues and failing to realise really the urgency of change and the savings that are possible in our health system to deliver a better provision of healthcare for New Zealanders. And I mean, we can think of examples recently: $140,000 TV screens, $260,000 sun decks, New York apartments that cost $11 million, hair straighteners and so on. They're distracted by these issues rather than focusing on sorting out a healthcare system that would really benefit all New Zealanders. And as the Honourable Annette King mentioned in her speech, she and I did a tour through many rural hospital areas recently, and we heard from the people running those hospitals how useful it would be to have more nurse practitioners, how useful it would be to have that flexibility in the rural health workforce to help deliver the services that are needed. And of course, part of that requires this kind of enabling legislation that makes it possible for those jobs to be there, and of course training the workforce. And we travelled down through Timaru. We visited Timaru Hospital, which is considering, interestingly, amalgamation with Oamaru Hospital because of the crisis in funding. Oamaru is being threatened with a 5% funding cut in their hospital because of the underfunding by this government of health services. 5%. That's having had their funding frozen previously. We visited Maniatoto Hospital, where their struggle is to actually deliver services into the future with any kind of certainty in their rural community because the buildings are earthquake prone. They have a rating base of 1,800 people and a trust that runs it because the government wasn't keen to provide the healthcare services there. In Queenstown, we heard about the lack of availability of services there. For a population of 30,000 people, it swells to 90,000 in the tourist season. And in Dunstan Hospital, they have another model there, and further on in Clutha, they have another model there where they are doing more integrated service delivery. And in all of those areas, we heard how much more benefit we could get out of having this flexible, the more flexible health workforce that was trained in a contemporary way. And overall, I guess the feeling is that this government is dragging its feet. And I have to say, the communities we spoke to across the Otago region were very concerned about the cuts in funding, in real funding, during this government's tenure. That has meant that there are service cuts proposed in all of those rural areas. Several of those hospitals have accepted funding cuts next year. They've had their funding frozen previously. They've accepted funding cuts in the coming year. So it is amazing that it's taken so long to get this bill on the order paper when the need is so great in the health workforce. We do have Annette King to thank for her leadership in this area, for introducing those nurse practitioners with the master's qualifications recognised by the Nursing Council to conduct a range of activities that they are entirely able to conduct to create a modern health workforce that is responsive and financially sustainable. And I look forward, for one, to the Honourable Annette King not only nominally driving the officials in the Health Ministry, but actually also having that title. And I hope that time will come sooner rather than later, because the Honourable Annette King we also heard, I have to say, in Otago, that the halcyon days of health were under the Honourable Annette King. Public audiences told us that. They are still looking back to the time when, the brief time that Annette King was Health Minister. They're looking forward to her being Health Minister again, as am I. And then we will know that we will not only get this kind of positive progress, but we'll get more of it faster, sooner, and more convenient for the people of New Zealand.
Good, Steve.